We'll begin the webinar momentarily. Good morning, good afternoon, everyone. My name is Lauren. Welcome to the CANO ACIO webinar, Applying an Innovative Educational Tool for Nurses in Oncology. CANO ACIO's Adult Oncology Nursing Professional Development Continuum, presented by Jamieson-Wright, Kelly-Lyn Wilson, and Cheryl Page. We are excited for you to join us for this important discussion. Jamieson-Wright is an oncology nurse with a strong background in clinical practice education and system integration. She is a CNN certificate since she has been CNN certified since 2005, earned her Master of Nursing in 2011 and a Master of Education in 2017. In her current role as a professional program manager supporting cancer care, she provides strategic leadership to strengthen oncology nursing practice, support workforce development, and ensure high quality, consistent care across Nova Scotia. Kelly-Lyn Wilson is an education clinician at Hamilton Health Sciences in Hamilton, Ottawa. Within a portfolio of adult inpatient surgical oncology, she has over 25 years of nursing experience, with 13 of those specializing in surgical oncology and adult education. She also holds her certification from Canada Vascular Access Association since 2017. Cheryl Page is an education clinician at Hamilton Health Sciences in Hamilton, with a portfolio including adult inpatient hematology, oncology nurse, day services, and cellular therapy program. She also holds a cross-faculty appointment as assistant professor with the School of Nursing at McMaster University. The presenters will present for 40 to 45 minutes, followed by a Q&A session. During the presentation, all lines will be muted, but you can submit your questions anytime using the Zoom question box. If you have any questions throughout the presentation, you can also place them in the chat box. After the presentation, we'll address submitted questions. If you'd like to ask yours live, simply raise your hand and we'll unmute you during the Q&A. At this time, I'd like to present you today's presenters. Cara, Kelly-Lyn, and Cheryl, you may begin.
Sorry about this, but Lauren, I don't have the controls.
Oh,
sorry, when I froze. Sorry, everyone.
No, you're all good. You have it
Thank
now.
you. All righty. Okay, so we're going to be reviewing the application of an innovative education tool for nurses in oncology, and this is the update to the CANO ACIO learning pathway. So it's now the Adult Oncology Nursing Professional Development Continuum. Okay. So, whoops, sorry, went too far. We're presenting today on behalf of the CANO ACIO Education Committee, and as noted before, I'm Cheryl Page, and I'm joined today by Kelly-Lyn Wilson and Carrie Jamieson, also members of the Education Committee. So our objectives today include to review the updated CANO ACIO Oncology Nurse Professional Development Continuum, to apply the CANO ACIO Adult Oncology Nursing Professional Development Continuum to practice examples, and to identify some educational resources to support nurses utilizing the continuum to advance their professional growth. I'm going to pass over to Carrie first to start the review on the background for this work.
Great, thanks, Cheryl. And thanks everyone for joining today. So wanted to chat a bit about what brought us here as an education committee, updating the CANO learning pathway. So really reflecting a lot on the changing landscape of nursing and where it has evolved to in the last 10 years. So certainly the complexity of care has evolved. So our previous mainstay treatments, were surgery, radiation, and chemo. Now we have immunotherapies, targeted therapies, more surgical, intricate surgical interventions, stereotactic radiation, CAR T, clinical trials, to name a few. We also think about the location of care and how that has changed. We've seen cancer care shift from predominantly being in hospital to really shifting closer to home, and seeing cancer patients in all care areas. So, what are the needs of for oncology knowledge in all nursing areas? The demographic and nursing experience has shifted in that oncology nursing, used to be an area where a lot of more seasoned nurses were working, but certainly with HHR demands, we've seen that shift to more novice nurses working in our clinical spaces, and in some instances, even new grads. Which then, of course, with the retirement of those seasoned nurses, really does shift that balance of nursing experience. Technology, of course, is a big one. Our virtual care capabilities has increased, requires increased skill and competency for that autonomous, independent practice around assessment and communication. We've also seen safety technology, so advances in our PPE, our closed system transfer devices, our dose error reduction pumps, and of course, our shift to electronic charting. Roles have changed within oncology nursing. So, specialized oncology roles such as advanced practice nurses, cancer patient navigators, nurse practitioners, and then the demand. So, like I mentioned before, this used to be an area where nurses with more experience would be recruited into, and now we really are seeing new grads come into our clinical spaces. So originally, the specialized oncology nursing learning pathway was a description or a depiction of that shift from moving from a generalist oncology nurse towards specialization. And it really focused on that specialized oncology nurse and specific to some subspecialties around solid tumor, hematology, and radiation oncology. And we do have a picture just to remind folks of what that looked like when it was originally designed in 2015. Hopefully looks familiar to most of you. So when we stepped into the work to update this pathway, it's been a labor of love over a couple of years. In 2022, there was a workshop at the conference focused on introducing the idea, really identifying the need to update the pathway. Folks really wanted it to be more fluid. Was followed by another workshop in 2023 where we presented a draft design and gathered some more feedback. And then, of course, the final workshop for feedback in 2024, where we really came up with a solid draft and understanding of what members were looking for. We wanted to make this really applicable and reflective of the changing landscape that I just mentioned. And I should also say it was done in conjunction with the Professional Practice Committee because we also wanted to integrate the CANO practice framework. And then in 2025, for folks that were at the conference, we did present the new pathway. So some of the key pieces that we had, we had really important feedback from our engagement workshops that really helped us steer the direction of where you as members wanted to see this support tool go to help your work as educators and leaders. So, the importance of keeping specific education needs was a must that folks wanted to maintain. It was really important that it was understood and visual that career trajectories were not linear. So in the previous learning pathway, it could have been interpreted that all nurses were attempting to become in the few nurses category. So we really wanted to make sure that it was more visual of a continuum, which is that language shift as well. That many nurses are going to have a really fulsome career in one category and have that ongoing continuing education within each category was a need within the continuum. And that prior pathways were really, as I mentioned, were for the specialized oncology nurse. But when we looked at integrating the practice framework, we identified that, that that some, few, and all categories really needed some support wrapped around it as well. So as I mentioned, another key piece of this was integrating the CANO learning or the CANO practice framework into the learning continuum. So for those that might need a little bit of a refresher on what the knowledge and practice framework is, it was originally designed in 2019 and is really in place to reflect the framework of what the practice needs and the knowledge that is required to care for cancer patients across the continuum in all practice settings. So that's that all, many, some, and few. And we do a visual to just remind folks of what that framework looks like as well. So this is what we really wanted to also incorporate into the learning continuum. So as part of the exercise of integrating the framework, as well as the feedback, we did go through a process or an exercise of walking through each of the practice domains, so that all, many, some, few, and identifying, and in some cases expanding on the knowledge that was required for each of those practice areas, and utilize the CANO standards and competencies as a guide to for those education needs as well. So really taking this above and beyond what the previous version was with respect to including all practice areas and beyond the specialized oncology nurse. And I'm going to pass it on to Cheryl.
Okay, so now we're going to introduce the new CANO ACIO Learning Continuum. And again, as Carrie alluded to, we'd like to acknowledge all the input and feedback from the CANO ACIO members and the revisions for this tool. Alrighty, so let's review the revisions to the learning pathway as it transitions to a learning continuum. The previous learning pathway had a focus on only the specialized oncology nurse or the some nurses category, while the revised learning continuum is inclusive of all 4 categories, again, to mirror the nursing knowledge and practice framework for cancer care. So we now have included the all, many, some, and few categories. The previous pathway had 3 sections: foundation, specialized, and professional development and leadership. The revised learning continuum's principles and language are more aligned with the CANO ACIO framework for the 7 categories or domains within the standards. And there's also scaffolding of knowledge that occurs within the categories through continuing education. The previous learning pathway is both linear and detailed. This older pathway didn't really acknowledge that nurses may have a fulsome career in other categories besides the some specialized oncology nurse category. The older pathway also didn't account for continuous education and growth except within that specific category. So the learning continuum now embraces the diversity in oncology nursing and acknowledges some nurses may stay in one category where others may move between categories. And then when they do so, they bring transferable skills with them. So the learning continuum is basically an overarching document and it's detailed within each nursing group. The older learning pathway consisted of specialized section with subspecialty information for solid tumor, radiation therapy, and hematology. The learning continuum, on the other hand, has language again aligned with the CANO framework for categories of nursing. So the specialized oncology nurse section aligns with the framework and can be adapted to various subspecialties rather than just including a few separately. In the learning pathway, the professional development and leadership section focused on being an expert mentor. The learning continuum encompasses nurses to self-identify professional development needs based on their roles and responsibilities. So this is the first page of the learning continuum, and it's based again on the framework. Under each section, the oncology knowledge expectations are noted, such as for foundational for all nurses, comprehensive for many nurses, specialized for some nurses, and advanced specialized for few nurses. The tool then focuses on how the knowledge and skills are applied in each category and notes the usual setting for each area. So if we review each of the boxes, the All Nurses category integrates cancer knowledge and nursing competencies when caring for people with cancer. This group is looking at foundational knowledge in non-oncology settings. So in other words, cancer is considered a comorbidity here. Many Nurses category applies knowledge and competencies in cancer care at a more comprehensive level in specific care contexts. This group needs tailored oncology knowledge in non-oncology and oncology settings for specific healthcare needs related to cancer. The Some Nurses category applies knowledge and competencies according to standards for the specialized oncology nurse. This group focuses on specialized knowledge and experiences in cancer care in oncology specific settings. The Few Nurses category applies knowledge and competencies for specialized cancer nurses at the advanced level for expanded practice roles. These are the graduate prepared, expert, and specialized cancer care nurses caring for complex oncology patients. Additionally, for the Some and Few categories, they would link to the specialized oncology nurse standards as well as a CNA certification expectation. There's acknowledgement that this is a progressive journey as nurses are going to identify knowledge, skill, and behavior learning needs through reflection throughout their career. And this slide just shows what the actual resource looks like. So it's more in a page format. And if you click on the All, Many, Nurses, or Some, Few categories from the online version, it will hyperlink to the appropriate page. So these are the pages for the individual categories, and these are the first two. You can see that under each of the practice domains, there's content that would be applicable to nurses in this role, again, based on the CANO ACIO framework. There's also hyperlinks at the bottom to the CANO ACIO resources that nurses can refer to when looking to meet their educational needs. So this includes things like webinars, pocket guides, co-stars, the Conji Nursing Journal, survivorship manual, and patient navigation resources that are available on the CANO website. There's no hierarchy with this, but an acknowledgement that while varying levels of oncology knowledge may be required in different areas, all areas are necessary in the care of our oncology patients. There's a focus on continuous learning rather than a pathway. And again, this is less rigid than the pathway was and does acknowledge that nurses transition between groups and bring transferable skills with them that they're going to build on. Okay, let's look at the next two pages. So these are the last two pages, and they include the Some and Few nurse categories. So additional resources are linked in this section, including links to the CNA certification site, as well as to the specialized oncology nurse standards that would be applicable to these two groups. Here you can see there is an additional oncology nursing knowledge requirements noted in each of the domains. Again, under each of the practice domains, there's content that would be applicable to nurses in this role based on the framework. Noting that the all nurse category on the previous page includes all nurses. So the content for that section was not repeated in subsequent sections because all nurses fall within that group. I'm now going to pass over to Kelly Wilson, who's going to look at potential applications for this tool.
So the great thing about developing this was actually being part of looking at how we could apply this to future scenarios. So the wonderful thing is that this learning continuum can actually apply to both novice nurses, experienced nurses, as well as people in roles like myself as an educator or potentially a manager. For those that are novice nurses, as they often lack either the experience or the exposure, the learning continuum can inform self-directed learning plans and can help the learner navigate the knowledge areas required to prepare for specialty certification in oncology nursing. Those that have experience and are moving between different roles or different career trajectories can also use the learning continuum to support their professional development, and also in supporting and maintaining competencies, credentials, and also enhancing them in terms of leadership skills. For people in roles like myself in education, the learning continuum can actually help to facilitate and planning and development of standardized oncology orientations and also continuing education programs. So, One too far. So just a quick reminder, as Cheryl had alluded to, there are several resources available when you are exploring the continuum with your learners and your nurses. The CANO site has lots and lots of educational tools, including the framework, standards to practice, specialized oncology nurses, radiation, systemic therapies. There's also a self-assessment tool, pocket guides, survivorship manuals, co-stars. We don't want to forget ConJ, webinars like today, where you get to expand your knowledge and learn from your colleagues as well as other external professional development opportunities that are often linked through the CANO website. So let's just look at a couple different case scenarios and how we might go about applying this particular tool. So our first case scenario we're going to talk about will be related to a new graduate who has little to no hands-on experience, who is hired to a surgical oncology unit. The second case we'll talk about is a nurse with greater than 10 years experience, oncology experience, who is now going to be working in an outpatient oncology clinic. So our first case scenario with our new graduate is our new graduate, Janice. She's graduated from a university with a Bachelor of Science program in April of 2025. She passed her RN exam in June and is very excited to be hired as a full-time nurse on a surgical oncology unit. I have lots of these, lots and lots of new eager nurses who are very excited with their first career, and they're coming right out of school. Her past clinical experience includes placements in a medicine unit and in an outpatient clinic. She's 22 years old, and her past work experience was supporting her university education by working as a lifeguard at a local outdoor pool in the summers. So our new graduate nurse, Janice, has completed her CANO self-assessment tool. So for those of you that might not be familiar with the self-assessment tool, this is from the practice standards and competencies for the specialized oncology nurse. And the purpose of this tool is to enable a specialized oncology nurse to kind of reflect on their practice and identify personal learning needs. They basically look at each competency, and the nurse reads each statement and then self-assesses based on the Benner's model of novice to expert, where their level of knowledge and expertise is. At the end of each practice domain section, they tally up the number of scores for each of the Benner levels, and they look at their ratio of strengths versus opportunities and compare their individual strengths total to their opportunities total. Any scores higher in the opportunity areas are usually a good idea to explore for continuing education opportunities. So this is an example of Janice, who has completed hers, and we can see the results from her assessment. As a new grad, her ratio of strengths versus opportunities are identified on the right-hand side. And we can see, for example, under the comprehensive health assessment, she does not identify as a lot of individual strengths, but has identified as a lot of learning opportunities in that area. And pretty much most of her strength levels there, she's rated herself as a 0 and has identified quite a few learning opportunities. So when we're looking at Janice and we're kind of looking at the way that she has scored herself in terms of her self-assessment, I just want to propose a couple questions to you to think about. And we can use, I believe, the chat box, or you can raise your hand and think about what kind of areas for improvement do you anticipate with Janice? What strengths do you anticipate with this learner? And how would you, as an educator, preceptor, or mentor, use the learning continuum that Cheryl outlined to help guide this learner's education? So let's think about those first few questions and use the chat box or raise your hand if you want to vocalize. What kind of areas for improvement do you anticipate with this learner? Very quiet, please. Don't see anything. So here's my thoughts. So this learner has perhaps not had the opportunity to develop their experiential knowledge. Ooh, I see some things, or application of what they've learned in school. Some people have talked about they maybe are not well versed yet in post-op assessments or assessments in general. Perhaps their strengths is that they have outside nursing experience they could help with. So lifeguarding would be an example of working with the public. So they might have some transferable skills that way. Often with new grads, it's about confidence and practice. Some areas for improvement could be confidence, skills, tasks, assignments. Their strength is usually their willingness and eagerness to learn, for sure. They often focus on how to do something rather than the why behind it. Some areas for improvement could be expanding oncology knowledge base in a structured way that would be beneficial, for sure. Often these learners who are coming out of fresh from school bring a fresh viewpoint, and sometimes they have the newest research or literature in nursing. So how would you, as an educator, preceptor, or mentor, use the learning continuum to help guide this learner's education? I'll give it a few seconds because I think there's a bit of a lag with the typing. So my thoughts is that this learner would start at the beginning of the pathway, as they would need basic nursing orientation, as well as basic oncology information to build on. I like that you have pointed out that this nurse can decide which areas to focus on. They can use the continuum to assess where they are now, and it will help to focus on growth as a novice, and figure out where they want to go and where they need to be. The continuum gives them clear expectations and helps to outline and focus where they like a trajectory of where to head. A couple other thoughts to think about is, how would you guide them to identify areas for opportunity and growth, and what resources would you direct them to for these opportunities? Yep. Somebody has mentioned that we could use the CANO pocket guides to focus on the basics. We are using the guide as a framework to build a structural plan for learning goals. I like that. That's the way I like that. And a way to assess learning through integration into the unit. We can link them to all of those different resources that Cheryl had pointed out and that we listed, different webinars, thinking about different types of oncology textbooks, oncology courses. I know for myself, when I was new into becoming, identifying as an oncology educator, D'Souza was an interesting pathway to go down as well, to look at, different types of educational opportunities to grow yourself as an oncology nurse. Again, we're talking about looking at, is there an appropriate mentor to help, making those really good, solid foundational links to embodying yourself as an oncology nurse. It's something, that's very, something to be proud of. And so you want to make sure that these oncology nurses stay in oncology, and that they really, feel it and grow. There's lots and lots of opportunities. For brand new to oncology, there's lots of easy to learn information. There is certainly a lot out there. All right, so some other thoughts to think about is how we would apply this continuum to a different type of nurse. Oh, I like the Canadian Cancer Society too. We want to make sure that we highlight that information. So in our second case scenario, we have Sarah. So Sarah is an outpatient clinic nurse with 5 years of nursing experience on her unit. She has transitioned to an area after working 15 years on an inpatient oncology unit. She is considered a resource for her team and often is a preceptor to new staff. Sasha would like to obtain her CNA oncology certification and is meeting with you to discuss her knowledge and tools and the tools at the disposal of the team to assist her in meeting her goals. So again, we have Sasha, who has completed a learning assessment or self-assessment, and these are her scores, which you can see are quite different than our new grad, where she does possess quite a bit of individual strengths when it comes to comprehensive health assessment, as well as management of cancer symptoms and treatment side effects. but she feels as though her learning opportunities in that domain are quite significant. So you can see the ratio of 16 for individual strengths is a little bit lower than the learning opportunities of 25. So as an experienced nurse, her ratios versus strength, her ratio of strengths versus learning opportunities obtained by comparing her individual strengths totals to her learning opportunity totals. So again, with this particular scenario where we look at these ratios, I'll propose the same question on how we might utilize this tool. What kind of areas of improvement do you anticipate with this learner? And what strengths do you also anticipate with this learner? I'll give it a second for typing. So Anita has said this is a new area of focus, and are there transferable pieces of knowledge? That's a good point. This learner has not yet had the opportunity to develop oncology specific knowledge or application of what they've learned throughout their oncology nursing yet. And their strength is that their experience in oncology nursing, there's lots of experience that can be applied to this area. As an experienced nurse, probably time management is very strong. They bring quite a bit of knowledge already that they can use to build upon in a new setting. They are motivated to learn more in oncology and ongoing mentorship. Yeah, maybe perhaps the preceptor and mentorship piece is something they're proud of, and something you might want to foster in their new area, something they can work to achieving in their new role. Maybe she was a bit lower in the leadership and some areas of knowledge, but so fostering that in terms of formal precepting and coaching courses would be important. I like that. Yeah, for sure. So how would you as an educator, preceptor, mentor use the learning continuum to help guide this learner's education? I think, Joy, you brought an important piece there is fostering, what they already have and growing that more. And maybe connecting them with more formal precepting and coaching courses is a good idea. So we would use the self-assessment tool to assess their knowledge gaps to work in this new area. They would need to learn more about outpatient nursing, including an increased focus on patient education and communication, perhaps. With their background in oncology nursing, this learner would bring a lot of oncology-related transferable skills and experience, including things like we said, communication, time management, assessment, critical thinking in the oncology setting. We might want to ask about how to integrate her into the new area and still validate their experience and knowledge coming to another area. And that's the great part about the continuum is it's not hierarchical, right? That it does, account for the fact that we bring our experience and our knowledge and we transfer that with us. And it's an opportunity to reflect and look and grow and say, hey, where do we want to be? Where do we want to go next? Is there something I want to do for ongoing professional development? Very good. Okay, so what type of resources would we lead them to? I think we talked about preceptorship and mentoring courses. Of course, again, pointing them in the direction of webinars. Something I'm trying with my surgical oncology staff that are experienced is really getting them to embrace being an oncology nurse by doing poster presentations at CANO, or I'm trying to really work on getting somebody to be a speaker, pulling them outside of their usual day-to-day and getting them to really develop their own, professional self by, exploring opportunities that they Sorry, it kicked me out for a second there. Surprise! I've lost control, so somebody's going to have to forward my slide for me. Oh, I got it back now. Perfect. Okay, so a couple things to think about. The learner can self-assess and identify and focus on areas, on closing their learning gaps. The learning continuum can help them to formulate a study plan with timelines. I like what Joy has said, where, CANO ignites a fire in people. And a passion so that they are, and it's fun and they're networking. I think networking is a huge piece too. So, the continuum kind of brings forward all of these resources and really helps, give you that moment of self-reflection to say, hey, how am I going to be the best oncology nurse I want to be and what's available to me? Regardless of not if you're a new nurse or if you've been at this for, 10, 20 years, or some of us have been, at it for longer than that. But it certainly is an excellent tool. So that being said, there are some next steps and, some future steps, we'll say. Part of this is that the practice standards and competencies for the specialized oncology nurse are currently in the review process and are going to be undergoing some updates. The CANO ACIO nursing knowledge and practice framework for cancer care will then be in line for an update to align so that there's a better alignment. And once all that is done, then the learning continuum will be reviewed and updated to align with any of the updates to the framework. So it's kind of a nice cascade of, making sure that things are all symbiotic with one another. So with that being said, we'll open it up if anybody has any thoughts on the learning continuum, or do you have any questions you'd like to ask of us? Feel free to put them in the chat and I will read them out. Quiet group. Okay, I'm not seeing anything. Oh, something. So the question to my colleagues, will the standards and competencies will all the standards and competencies be updated?
Yeah, they will be. If you're thinking of the specialized oncology nurse standards, those are the ones that are currently in process. And Kara can probably also
yeah, I'm
speak
seeing
to
Lauren just clarified as far as the systemic therapy and radiation therapy standards. Yes, those will also be in the cascade of as the new standards and capabilities are being finalized, recognizing that that is such a foundational document for CANO that all of the resources and tools will need to be updated to reflect. Is there a section for brachytherapy? I would defer to the radiation therapy SIG, who I think is going to be leading that work, but I would be shocked if it is not included. So I would confidently say yes. We certainly know those ones that we have to get.
In previous conversations, we had talked about, surgical oncology ones as well, and the
surgical oncology.
Yeah, yes. The potential for future development of this. It's funny how I don't remember if it was, I think it was Joy who said that, this CANO sparks a passion in people. It wasn't until I got involved with, the education group that I was like, I kind of wrote my hands together like an evil, person. I was like, what about surgical oncology standards? Because I kind of always feel like we're left behind.
The other piece that came up as well in our engagement sessions around the standards and capabilities was around the clinic nurse. So I think there's some appetite as well looking at that role and really digging into what those, how the new standards and capabilities.
I like how Miranda has validated my thoughts about, more integration of surgical oncology. Be careful, Miranda, because we might tap you on the shoulder then. And people love being a cheerleader for CANO. And Somebody had mentioned up here too that there was they were developing a new grad network in BC, programs for new grads, and so this fits beautifully in with their network, which is good. Perfect. Okay, I will hand it back over to Cheryl and Kara if you have any closing thoughts or anything you want to say.
I just want to thank everybody for, the really good input and everybody participating. We really appreciate it. And if anybody has any more comments on the learning continuum, we feel free to send it on to the education committee. And just so you know, it is currently available on the CANO website, the updated one.
Thank you all for joining us, and special thank you to the presenters for their presentation. An email will be sent shortly with instructions on how to claim your certificate of completion. If you have any further questions, please send your questions to the info@cano-acio.ca and we'll forward your queries on to presenters. Thank you all again and have a wonderful day.